And we've got a few supplies here. This is the Alphatrak pet glucometer. These are the test strips, which have a code on them. One code is number 35 for dog, and the other is cat specific. So we're going to be using that dog code today. This is a Lancet device, which we've got set to number 4 on the setting. That is the one that you want to have that on. This is a Lancet, and then we got a cotton ball so we don't poke ourselves. So the first thing we're going to do is just load up our Lancet device. You just pull this off, pop this in, and then you twist this and pull that off, and there's a little teeny tiny needle right there. And then we're going to replace the cover. And then if you push this button, you can hear it click. If you pull this back, it's locked again. So now this thing is ready to go. And then next we're going to go ahead and insert our, well, first I'll show you where to get the blood on the dog. One place I like to use is this carpal pad here. You can't get blood very easily out of this black part, but if you go right where the black part meets the hairline, that's, for a lot of dogs, kind of a good spot to get a blood sample. I don't like to do it from these pads down here because a lot of dogs are very sensitive, as he is. You can tell about having his feet touched because he feels like he's going to get his nails trimmed. So I like to do it from this little junction right there where the black kind of meets the hair. And so that's where we're going to go. And we're just going to load up our Alphatrak with our little strip here. So the way that we do that is to just put the metal part directly into the glucometer. That'll get it to turn on. And then we're going to look at the number. And it's set to 35. If you needed to change that, you can push these buttons. That's ready to go. And now it's blinking with a little blood droplet. So we know that it's ready to accept our sample. When we take our sample, we're going to put it here on the side, not on the front. So we're going to load the sample on the side. So we're going to go ahead and get this little blood sample on Brennan. I'm just going to hold his foot, and I'm going to line this up right there, try to get it right where the hair meets it, and push the button. And then I'm going to hold it with some pretty firm pressure for about 5 seconds. And that's just allowing that little blood sample to get into the well of this little hole where the Lancet device is. And I can see it, it's tiny. One of the reasons I like these Alphatrak glucometers is because they require a very, very small blood sample. So I have a very small blood sample there, but I may need to kind of squeeze it a little bit because it's too microscopic, but it is there. And so we're just going to be patient and just kind of let it, see it there, little tiny blood sample. That's all you need. So I'm going to just hold it to the side, let it take my sample. There we go. And there, it's taking my sample.
Good boy.
And put the little cotton ball on Brennan. And so he's 357. Good job, Brennan. Good boy.